All right, this video is about the derangement syndrome in the mechanical diagnosis for the McKenzie protocol, McKenzie method of mechanical diagnosis and therapy. This is straight from Part A, their textbook, their book for the actual course. So, not from the lumbar spine mechanical diagnosis and therapy textbook. This is a more condensed version of those books. So if you want the full synopsis, go to the textbooks. This is specifically about the derangement syndrome. Derangement syndrome is the big hallmark for McKenzie protocol. This is where McKenzie really shines. So when the derangement, straight out of their book, derangement syndrome is a clinical presentation associated with a mechanical obstruction of an affected joint. Mechanical obstruction of an affected joint, okay? Directional preference is essential. That's key. Essential. And centralization is an important feature and an important phenomenon. We call it a phenomenon in the McKenzie world, centralization. We see it with the spine, specifically when you start going more into the McKenzie world, they start talking about centralization of other joints as well. Features of the derangement, it is number one, the most common, again, inconsistency and change can be characteristic here as well. So things can change, things can be variable. Clinical presentation is variable. That is important. I'm gonna even underline it here. Variable. So, pattern in the history, speaking only from the history here, not jumping to their mechanical test yet. The location of the pain may be local, referred, radicular, or a combination. Hurts here, hurts there, hurts along this pathway. Sometimes it hurts here more than it hurts here, etc. Symptoms may move from side to side, proximal, distal, vice versa. Symptoms can be constant. They can also be intermittent. Therefore, again, straight out of their textbook, they are variable during the day and over time. So variable symptoms can change. It can be comes and goes, etc. Pain may arise gradually or suddenly, often with an insidious onset. Typically, if we're thinking you have somebody present to your office, I hurt my back deadlifting, not jumping straight to derangement, okay? Typically insidious onset, type of person you hear, I hurt my back bending over to tie my shoe. Onset may be accompanied by a sudden disability. Again, key finding on that one. Symptomatic and mechanical presentations are often influenced by postural loading strategies during activities of their daily living. So this is where we're dealing with the person that's changing what they're doing to avoid pain. Movements and postures cause symptoms to increase, decrease, centralize, peripheralize, produce, abolish. Again, this is, if we're really thinking about the derangement being a mechanical obstruction of an affected joint, that's where the history, mechanical obstruction, everything has to do with mechanical obstruction of the derangement. The sustained postures and activities, this is where they'll say, oh man, it just really feels better when I do this for a long period of time. When I sit for a long period of time, we hear these clinically all the time. I've been sitting. It hurts most when I drive for a long period of time. Or feels better when I fill in the blank for a long period of time, right? Derangement, flexion intolerance, we're really thinking like sitting for a long period of time hurts, sitting on a couch hurts. And then another key here is sometimes they have a history of these episodes. That's one of the fill-in questions on their form. History of episode 0, 1 or more, and you just kind of fill in their form straight from there. When you go into the exam, you're looking for patterns, okay? Patterns, this is, again, the big key finding, thinking exam, thinking derangement, we're thinking Very specific. Mechanical obstruction of an affected joint. If there's a mechanical obstruction, this doesn't move like that, you are going to see a pattern of motion to either avoid it or work around it, or stop when you get there, essentially. So mechanical presentation always includes, always, you know, we always, we think, don't live in the terms of absolute. Mechanical presentation always includes diminished range of motion, or obstruction of movement. Okay, straightforward, very simple. Mechanical obstruction of an affected joint would lead to a diminished range of motion or obstruction of movement. Simple. Sometimes there's a temporary deformity, kyphosis, lordosis, lateral shifting. We're not thinking of hard, lateral, relevant. We're not thinking lateral shifts like that quite yet. We're really just thinking sometimes they're stuck in some sort of deformity too. We see it all the time. You know, we see patients start moving around and they will avoid moving their spine into flexion because that hurts. Mechanical obstruction. So again, sometimes there's a deviation of normal movement pattern. This is where you'll see a patient returning from flexion. You know, as they touch your toes, they'll come down. If they have a decent range of motion, they'll come back up and they'll work around that painful obstruction. So they will sometimes have a deviation. Sometimes loading strategies can cause lasting changes. This is where the mechanical exam shines. Repeated movements can cause the symptoms to produce or abolish. Repeated movements can produce or abolish symptoms. McKenzie Protocol 101. Basically, you have your baseline motion. Repeated movement exam, better, not worse. Not, you know, basically you're looking at better, not worse or worse. Does it change? If it does not change, you're not thinking derangement. Repeated movements cause decrease in range of motion as well. In the derangement syndrome, forces must be applied to achieve reduction, and in doing so, these forces to achieve the reduction, these loading strategies will centralize the symptoms or make symptoms remain better. Produce symptoms no worse, produce no worse, or basically you're trying to improve the symptoms through the motion strategies. Prone press-ups, it hurts a little bit, it hurts a little bit. I can go a little bit further, it feels a little bit better. I typically say around 6 or 7 reps, that's what I'm looking for. When it starts to feel better through motion, it's either going to centralize symptoms, they say it hurts more in my back, or the symptoms remain better, period. So that is a key factor of derangement. This in the McKenzie Protocol, Mechanical Diagnosis and Therapy, this is the most common reason for patients to seek assistance in the clinic. This is number one, most common hallmark McKenzie derangement.